Hello and welcome to our tutorial video on how to support University of Gloucestershire students as a practice supervisor or assessor in placement. During this session, we will look at the roles and responsibilities of the student, university, practice supervisor and practice assessor. We will look at the documentation and the EPAD and what the requirements are for that. We can discuss the placement-specific information and the hours, and also what support there is available for the student should they find they're struggling to achieve, or if you or the student are needing any advice or support throughout the placement. In September 2025, the University of Gloucestershire curriculum and programme changed. This means that students now work a slightly different working pattern. Whereas previously they did 22.5 hours a week for most of the course, they now do between 15 and 37.5 hours, depending on which week of the programme they're in. The year planners are available on Practice Support website, and they clearly document on there when the students are expected to be in placement and which days they're supposed to be in university or on leave. There is an example here on the screen for you to see. And there is also now an 80% minimum attendance requirement in order to pass the placement. The students will be allocated a certain amount of hours on ARC, and they need to make sure that they have achieved at least 80% of those across the placement. If they are off sick for like a considerable amount of time, so they've had a week off and they've asked if they can make that up later in the placement, that is at your discretion to do that if you have the facilities available to be able to support them. We encourage students to do a variety of all shifts in line with the placement shift patterns, including nights, weekends, long days if they want to, as per NMC requirements. So the NMC states that students have to do the full range of shifts. And you can see an asterisk there. It says that they may have a health abilities passport and reasonable adjustments.
If they do, we will cover this later on in the session.
Students will attend university usually 1 day per week, and this will be on the same day each week as per their planner. And they may also undertake one personal study day per week, and that's in their own time and for them to sort out in their own hours when they are not rostered onto placement. So students shouldn't be dictating when their personal study day will be, but we cannot roster them on the day when they are in university. Students now also have an hour of protected learning time within placement each week. So this is during placement hours, and it gives them the opportunity to research or reflect and consolidate their learning about something they've learnt within placement or something they've experienced. And they will document that in a new section on the EPAD. UOG students will have 2 placements for each year of their course. In first year and third year, the practice module runs across the entire year. So the students get 2 placements within that year. And the first one is formative, which means it's kind of like a preparatory assessment. And the second one is the summative assessment that needs to be submitted by the students. So all of the EPAD requirements have to be completed by the end of the year period, so the end of that second placement. In second year, both of the placements are summative assessments, and this is because we have students that join the course halfway through at the 18-month mark, and they can't join halfway through a module, so they are separate modules. And if a student doesn't achieve everything that they need to within the placement, whether that's at the end of first or third year or partway or at the end of second year, they are then offered a retrieval opportunity. So that's a 4-week placement in the summer, and that's to make up anything that they have not yet achieved. Students will submit their timesheets electronically to their practice assessor, or it may be somebody else within placement that's nominated with that responsibility. This is an electronic system, and it will just send you through an email with a link that you click on, and you can check that they've put in the correct hours and then submit it as complete. Students do make mistakes sometimes with their timesheets, or they might not include their break times. So please do check that they are correct, because if they claim for hours that they haven't done, this can be fraudulent towards their total amount that they need to do within the course. Absences must be managed as per your local trust guidance. So if your local trust policy is that staff members would phone in and inform the nurse in charge, then that's what students would need to do. It may be that within small community teams or settings, they text somebody or send an email. Whichever is the most appropriate thing for your team, that's what the students would be expected to do. And obviously, they should be informing you that they are absent from placement and why. They also need to email practiceabsence@glos.ac.uk to inform us that they're not attending, and that absence inbox is monitored by the coaches in practice, and we keep an eye on it. And if students are repeatedly off, we will reach out and see if they're okay. If for some reason a student doesn't turn up to placement, you can't get hold of them, and they haven't let you know why they're not there, please email the coaches in practice at practice support, only because that's the one we monitor a little bit more than the absence inbox. So if there's any welfare queries or anything and we need to chase the student, we can do. And we would ask that you get their sort of maybe their telephone number or private email at the beginning of placement, so you have a way of contacting them if you need to for any reason. Okay, so moving on to the roles and responsibilities of the different members of the team. So supervision of students is referenced within the NMC Code of Conduct, which states that it's kind of within your nursing practice to support learners and colleagues. So we've moved away from kind of one-to-one specific mentoring over the past few years and much more into practice supervision and assessment. So all registered nurses, midwives and nursing associates are able to be supervisors for a student during their shift. It could also be another registered healthcare professional, such as a physiotherapist, occupational therapist, doctor, any of those sorts of people within the MDT can supervise a student as well. A good learning environment is really important for students to feel comfortable and settled throughout placement. So these comments here have come from our student evaluations and feedback from students about what they find a good learning environment to be. So really it comes down to being friendly and welcoming. Try to use the student's name rather than calling them the student, which can be difficult to remember them all when you've got lots of them on at once. But it does help them feel really included within the team. Getting them involved in handovers and the different learning opportunities there are within the ward also helps them feel included. If you have an induction pack for your area, that can be really good to give the student when they come and visit prior to starting or on their first day, so they know what to expect and what learning opportunities there are available. And then on their first day, a good orientation to help them know all the kind of safety procedures and where to put their things and where to go to the toilet and make them less anxious. Ideally, providing some feedback during each shift can be really, really valuable. So if you're working and supervising a student that day, just give them a little summary at the end of, you did this really well today, maybe go away and learn a bit more about this, and next time let's focus on this kind of thing. That can be really, really useful at helping the student work out where they're at with things. And also a timely assessment feeds in really well to them feeling settled in their placement environment and knowing that their mid and endpoint assessments and EPAD will be completed on time. Feeding into this is the NHS England's Safe Learning Environment Charter, which has come in over the past couple of years. And really, it just gives us a precedent to how we can be supporting our students and creating that good learning environment for them. There's lots of different aspects for you to have a look at within this if you want to, and see whether your placement area offers everything necessary. Okay, so we're going to have a little look at the difference between practice supervisors and assessors. So practice supervisors will be the person who's kind of supporting and supervising the student day to day. So that'll be if you're in a ward, it's going to be those nurses that are allocated the patients and the students are working alongside them. In a community team, there might be less of you, and in other settings as well. So if you're in a small team, there might only be a couple of you that are supervising the student and you get to know them really well. In a bigger team, you might all get to know that student and all contribute towards their feedback. So you're going to be supervising the student and providing feedback to them regularly, ideally at the end of each shift, as we mentioned previously, ensuring that we facilitate learning opportunities and let them know what there is available. And if there's anything specific that they have to achieve, hopefully they can discuss that with you as well. You can sign off proficiencies and contribute towards EPAD completion. And raise any student concerns regarding their competence and conduct. So if they're working with you and you have some concerns, please feed that back to their assessor, or if their assessor's not in, you can also speak with the wider team or contact the university if needed to. And then actively discuss their progress with their practice assessor prior to mid and end point assessment and any other appropriate time. In addition to that, we've got the practice assessor role. So the practice assessor is going to be one key person that is responsible for that student for the duration of their placement. They need to be registered in the same field of nursing. So if you're a mental health professional, you will be assessor to a mental health student, and same with adult learning disability child. So also facilitating learning opportunities like the supervisors do, but you may work with the student a little bit less often, and it's going to be a team approach regarding those learning opportunities. You should be actively seeking regular feedback from your practice supervisors and collating evidence prior to the assessments, which should be completed by the dates required. And the student should know when their mid and end point assessments are due. And they should be making sure that those are booked in with you. If you have any concerns about a student, please escalate this in a timely manner, and that's the practice assessor normally that would do that, and contact the university or whoever's necessary, and we will talk about support in a little while. If the student is requiring improvement or struggling with any aspect of the placement, the practice assessor would be the one to commence an action plan with support from us as well, and also signing the students' timesheets and making sure that they're being taken care of. So at the university, we've got the academic assessor, so the AA, and the coaching practice, the SIP. So these are registered professionals who are employed by the University of Gloucestershire, and they are there for placement support and monitoring the progress of the students. So the coaching practice is the person that you will go to should you have any advice or concerns regarding the student's progress. You will have one coaching practice that will be linked to your placement area, so you may well already know who they are, but you will get to know them over time if you've got any students requiring kind of significant support. So they can visit placement, they can attend midpoints, endpoints, especially if you've got a failing student. It's really good to get them involved, and they can help you with action planning and kind of progress discussions with the student. They can also provide some training for you with the EPAD and support any new members of staff who are new to supporting students as well. They will then liaise with the academic assessor and let them know if there are any particular students that we think may well fail the placement. And then the rest of the role of the academic assessor is basically to monitor the EPAD progress and sign off the placement at the end of the module. So they will liaise with the coaches in practice, but they are much less accessible because they are the lecturers and practice module leads at the university. So they oversee the whole module, and they will be very much teaching at the university, and then will sign off the placement at the end. Okay, so we're going to have a look at the documentation. We use the EPAD, which is an electronic documentation, and it should be accessible on any computer, which can be really useful. So on the student's first day of placement, they will need to have an orientation checklist completed. So on their first day, students should be orientated to the placement environment, know where policies and procedures are, know how to raise and escalate any concerns or seek support should they need it in an emergency, and also things like knowing where the staff room is, where to go to toilet, all those sorts of things that will help them feel safe and comfortable on placement. This can be done by any nominated appropriate member of staff. So it could be the ward clerk or a healthcare support worker, anybody that knows that placement area well and can orientate the student to the environment. That will then be sent to the either the supervisor or the assessor, and they will sign that off for them. And it's just a tick box that comes through as a link on an email to say that they've done that on their first day, and any registered member of staff can sign that off for them. Next, we have the initial interview. So this will need to be completed ideally probably after their first few days in placement. So the students had an idea of what learning opportunities are available and how the placement works and what they can get out of it. They will also identify what in particular they need to get done within their EPAD. Between you and the student, you will discuss and create a learning plan, which they will identify within their initial interview. The student then writes up that plan and sends it to you again as a link in an email, and you just check it and sign it off. So it shouldn't take too long with those two. So just to note that student orientation and the initial interview can be completed by a supervisor. It does not have to be the student's assessor. However, the midpoint and endpoint does need to be done by the assigned assessor. After initial interview, ideally you would set aside some time and plan a midpoint assessment. This should be about halfway through placement, and it's a really good opportunity to assess the student against their NMC professional values, and the student will reflect on how they're practicing within the code and how they're progressing throughout their placement. You may also sign off some proficiencies or any other aspects at this point as well, and then you can make a rough plan for the remainder of the placement so that the student knows what they need to do to achieve. In the final week of placement, ideally, probably not the final day, just in case you have anybody off sick, but in the final week, you're going to be doing the endpoint assessment. So this is where all of the NMC professional values will need to be signed off, and they all need to receive a yes as achieved, or the student will fail that placement. So these are the underpinnings of the NMC code and all about their professional conduct within placement. The proficiencies also will need signing as well, any that they've achieved at this point. However, hopefully the student has also got some signed off throughout the placement. In addition to the assessments, the students will also need to complete an episode of care once per placement. For this, there are guidelines on the EPAD for each different episode of care, but first and second years are very similar, and it's all about the students completing some care for a patient and then reflecting on this under supervision from their practice assessor. In the third year, the guidelines do change slightly, and the first one is about supporting another learner and teaching them a skill. And then the other one is about management and managing a group of patients, getting them ready to qualify. So for the episode of care, the student will need to provide some care for a patient as per the guidelines, and then they will reflect on this and how they managed it, ensuring that they've covered the points that you can see on the screen here. And then the practice assessor, who hopefully has also been there to supervise the episode of care, will then discuss this with the student, fill in any gaps that there might be, and they can hopefully tick them all off as yes and achieved. If the student hasn't achieved anything and you're needing to put a no, please save it and send it back to the student, or reject it and send it back to the student, and then they can amend this or cover that point or do a bit of extra work prior to submitting it again. Because if you've got a no on it and it's submitted by the practice assessor, it will fail the episode of care, which will in turn fail the placement. Ideally, the episode of care will be planned in advance and discussed with the student and their practice assessor and planned. Students will also need to do an assessment of their medicines management, and this will be once per year throughout each year of the course. So it will be completed in either placement 1 or 2 of that year. However, students do need to maintain that proficiency, and if you did have any concerns that it had already been signed off and they weren't maintaining safe medicines management, please reach out to the coaching practice and we can support with that. So for this medicines management, there is a competency that needs to be completed on the EPAD, and there are a number of things that the student needs to evidence that they've achieved. Now, this may be done through all in one go in one drug round, and you decide that that's going to be the assessment process and you do it all rigidly at that point. Or it may be that you've accumulated this knowledge and evidence from the student throughout multiple drug calculations or interactions, and then there comes a time when you're very happy that they've actually achieved all parts of it. Whichever works best for you within your placement area is absolutely fine, providing that the student has administered some medications to a patient. It doesn't have to be a full drug round, it could just be a depot injection or an insulin or some pre-med for theatres or something like that. And then any items that aren't achieved through observation within the competency can be discussed or simulated, or the student can evidence their knowledge within it. Again, with the episode of care, if you put a no on any part of the medicines management, it will fail it and subsequently fail the year. So only do the meds management assessment once we know the student is kind of achieving it and they're competent. If you don't feel that they're ready yet, I would wait for further on in the placement. Obviously, if you're in the final week of the year and it needs doing, then that's absolutely fine. But ideally, wait until the student is ready. Students will also have a list of proficiencies that they need to evidence that they have achieved, and these are different in part 1, 2 and 3 of the course. Some of the proficiencies do have an asterisk next to them, and they can be completed in either second or third year. They don't all have to be done in either or both. So proficiencies can be achieved through a number of different ways, and we're just looking at on this screen here the different evidence that students can present to you in order to show that they've achieved their proficiency. Ideally, if you can observe a student doing it, then brilliant. That's probably the best way of you knowing whether they are competent at performing one of their skills and proficient at it. If, unfortunately, you are unable to observe it, or it's an additional skill that students won't necessarily do until they're qualified, but they're showing evidence that they understand it. For example, blood transfusion is one of the proficiencies, but students will not administer a blood transfusion until they are qualified. So if you look at the wording carefully within the proficiencies, it will state that they need to evidence their understanding of how to care for somebody having a blood transfusion. It's not saying that they've administered it. So it may be that the student supports a nurse looking after a patient who's having a blood transfusion, or they have done you a poster or some written evidence to show that they would know how to do that. For any of those additional proficiencies in that kind of way that involves sort of IVs or procedures that students are not allowed to do, they are offered the opportunity to do it in simulation at the university, and this should be covered within all of their skill sessions. So students should be able to reflect upon that skill session and what they've done there in simulation, and then also talk about how they would implement that in practice and evidence their knowledge to you. Students could also choose to write a reflection on something that they've done in a previous area, or something they've done maybe when they've been with a supervisor and they haven't received any feedback on it. So they might want to reflect on something and show you that they did do that on that day, and discuss that further with you. You could also do a simulation with the student. So you could create a scenario for them by where they're going to complete that skill in a simulated environment and talk through what they would do. The student could also provide some written evidence or a narrative, or create a poster presentation or a PowerPoint, or any way that they can kind of display their knowledge and evidence that to you. Feedback is a brilliant evidential way of signing off for proficiency. So if a student has worked with a member of staff and they've received some feedback from them and they've brought that to you at mid or end point, that is a really good way of evidencing to you that they have completed it. The other way is through discussion. So, if the student hasn't actually experienced something, say for example, one of the proficiencies is that the patient might hear voices. So the student may say, well, I've never had a patient hear voices. It would be, well, what would you do if they did? What support would be available and how would we go about that? So ideally, the practice supervisors and assessors will facilitate opportunities whereby the students can achieve their proficiencies throughout the placement. It may be that they go off for a spoke opportunity with a different department or a member of the multidisciplinary team, and then come back with some feedback or reflection of what they've learned within that time. They may go off as well with a member of staff who are happy to sign off a proficiency for them and access their EPAD to do that. And especially if you're working, say, in a mental health setting and you've got quite a specialist physical health competency, such as NG tubes or something that you will not be doing in your placement setting, having a physical health nurse to sign that off in something that they are competent in can be really beneficial. All proficiencies should be achievable in each placement, and sometimes you do have to think outside the box, but we shouldn't be having a scenario where a placement says, oh, you can't do that here, or there's no way you can get that signed off here, because there's many different ways a student can evidence it. They just need to be organised and be able to do so. So we've talked previously about the student providing evidence to assist with their assessment. So ideally, the student will collate some feedback and some evidence over the course of their placement and bring it to you at mid and end point for you to be able to draw on to help you in your assessment process. So within the EPAD, we have got some performers to print that can be really, really useful for students and practice supervisors to use in order to provide that evidence of feedback. So when you go on the left-hand column, drop-down menu on the EPAD and scroll to the bottom, there is a button there that says Performers to Print. So if you go on that, it brings you up on the screen that you can see here. And there's basically a printable option of everything that is on the EPAD. So if you want the orientation printed off, or you want some guidance printed off, you want the episode of cares, proficiencies, whatever it might be, you can print everything that is on the EPAD in a much more digestible format than if you just printed the screen, because it can be really difficult to print it directly from the EPAD. Within this section here in the middle, you can see that there is a whole host of different feedback forms that students can use. So they could, there's some patient feedback forms that you could choose to give to a patient and ask for some feedback on your student and how they've worked with them that day. It could be from their peers, but the one that can be really, really useful is the one that's third from the bottom there, which is record of working with and learning from others / interprofessional working. And what there is on that page is it's a double page, so it's one sheet of A4 which you would cut in half, and then it's just a little half a page that they could take around with them. And if the student is working with another member of the MDT or a supervisor that day, what they can do is just write on there, this is what I've learned today briefly, and the supervisor that they are working with can provide them with a little bit of feedback and sign it. So that can be really good when they've gone and done a specific proficiency with somebody, or they want to evidence that they've learned something on that particular day, because it is signed by the nurse that they have worked with. So that can be really good evidence if you're not working with your student very often, for them, a really easy in the moment way of them getting feedback that doesn't mean that supervisor needs to be going online, accessing their EPAD, etc. Okay, so if you've got any concerns with the student's progress, we're going to look at how we will support them and how you may implement an action plan. So if you have any concerns with the student's progress, you feel that they are maybe they're not engaging, they're not attending very well, they're off a lot, maybe they are showing some unprofessional behaviours or concerns with their conduct or safety or whatever it might be, our first step that we would recommend is having a chat with the student and raising your concerns with them. So in the moment feedback can be usually received much easier by students because they understand what it's relating to. And then ideally at mid and end point, nothing would be too much of a surprise if it's then further discussed. So meet with the student as soon as you can and just kind of say, how are things? I'm a little bit concerned about this, this and this, before you come to the coaching practice. Please do come to us afterwards though. But ideally it's great if the student knows why we are coming into placement and supporting, and that we don't surprise them with our presence, because sometimes that worries them and they wonder what they've done wrong. So you could also have a look back through the EPAD and think, is this a new issue? Has there been anything documented previously? Is this a pattern of them in previous placements? Or actually, Are they just having a really difficult time at the moment and it's really having a negative impact on their placement performance? Please involve the coaching practice as early as possible, and you may want to draw on your practice education facilitators within the trust if you're finding a situation particularly difficult for yourself as the practice supervisor or assessor. And then primarily, we as the coaches in practice will come in and support the students, but we will help be the go-between the two of you within those difficult discussions, and helping keep it kind of relative to the assessment within the EPAD and clearly show where that student is not achieving. The student may need an action plan for a number of different reasons. So if you've had a student who has failed on any of their professional values at midpoint, please do put them into an action plan, and there is a clear action plan area on the EPAD in the drop-down menu, and I've screenshotted it here so you can see what that looks like. And it's a very simple nature of concern, so you can write the professional value itself in there, or whatever else it might be that you are concerned about. So professional conduct or not turning up or attendance or whatever it might be can go into that box. In the next box, the student then needs to have really clear advice in there as to what it is they need to show and demonstrate. So within a meeting with the coaches in practice and the practice assessor, we should have some clear points of, okay, this is what the student needs to do in order to achieve this action plan. The bottom box will say support available and who is responsible. So it'll be the practice supervisors and assessors will be supporting the placement in practice. The student ultimately is responsible for showing the improvement and for working on the action plan and engaging. And then we've also got the coach from the university who will provide support as well. There's also a date on the bottom of here where you do need to say when it needs to be achieved by. Please make sure the students have an adequate amount of time to achieve an action plan. So if you're going to instigate an action plan with 1 week left of placement, it is not going to be achievable, and we're just setting the student up to fail. So as early as we can put them in place gives the student ample opportunity to be able to turn it around. Students should be aware of an action plan and ideally be completed with them. So we've had that discussion in person as well as it being documented on the EPAD. The coaches in practice may well join a conversation or a midpoint summary and implement the action plans for you afterwards based on those discussions if that's helpful. Action plans don't always have to be negative. So sometimes it might be that a student's really struggling with their confidence, and although you're happy that they will achieve, they could really use an action plan to really help them focus on the areas that they want to achieve and where they want to get even better. So it doesn't always have to be from a negative point of view, but we definitely need to have them in place if we have legitimate concerns with a student or they've not achieved anything at midpoint. If you have instigated an action plan for a student that you have concerns with, please just make sure you've let the coaches in practice know so we can come in and support the student and make sure they're doing okay. The students that are undertaking their final placement and then going on to be newly qualified nurses afterwards. So there is no longer a need to have a separate sign-off mentor role. So within the last few years, we've moved into the practice supervision and assessment, and any practice assessor who is trained and up to date can have a final placement student and sign them off at the end. And what they will need to do in order to sign that off is complete an end of programme checklist. And what this does is confirms that the student is practicing independently with minimal supervision. So that is the requirement that is needed. So if you have a student that you do not feel is able to practice independently with minimal supervision and you're concerned about their progress, this is not a student that we are wanting to pass at the end of their placement. As mentioned previously, students do always get a second opportunity to complete that placement and have some extra time. So they initially get a retrieval placement, and if they fail the retrieval placement, they can usually then retake the entire module as well if they need to and do an entire final placement again. So there are always options, and what we don't want is students to qualify or be signed off before they are safe and ready to practice with minimal supervision. So if you do have a final placement student and you are worried that they're not going to be ready, please reach out to us and we can provide some support and guidance And it may be that the student's feeling that way as well. It may be as well that that they owe hours, or they've had a significant amount of time off throughout their programme. And whilst they are in their final placement, they may have sort of a few hundred hours outstanding, which means they will then go into a make-up hours placement after this placement as well. And the end of programme checklist won't be completed until the end of all of those hours. After that bit has been completed and signed off, the academic assessor for that placement will then review all the assessment documentation in the EPAD, ensure that the OAR, so the ongoing achievement record, has been signed off, and they then confirm that the student has completed everything and that the practice assessor has signed them off, and they then recommend the student to be put forward for progression onto the professional register. So the responsibility for that lies with the academic assessor at the university to make sure they've reached the standard expected. If you do have a student who is having significant time off or health struggles, or is really not achieving in placement, and they've told you that they've got a lot going on at the moment, we do have some really great university student centres at our various campuses within the university. So the student centres can signpost our learners to many different areas within their team. So it may be they can offer housing support, money advice, academic support, writing, and also counselling and mental health support as well. So there's lots of different areas. If students also need to apply for extensions or interrupt the course or have a break, they can support with all of those processes as well. Students also have a personal tutor who is a lecturer at the university who will meet with them multiple times throughout the course and go through their progress and offer support with that as well. If it's very much placement support, the coaches in practice will probably be your first port of call, and we can then signpost on to the other areas anyway. So if you've got a student on placement and you think they're struggling, probably reach out to the coaches in practice, but it's really good to be aware of all these other avenues that are there available as well for the students. You've got in most trusts you've got your practice education facilitator team as well, so it may be that they kind of keep a little closer eye on the student and offer a bit of support within placement and pop in and keep an eye on them a bit more as well. If you have significant concerns about the student's physical or mental well-being, you may want to tell them to book a GP appointment and get a review, and we can then also get occupational health involved if we need to as well. But again, the coach in practice would discuss that with the wider team at the university first, and then go from there. Some trusts as well do have their own wellbeing services that are offered to students too, so it might be worth seeing what you've got locally, especially if our blended students are needing support. It may be closer to home in the placements near them, because they have their placements nearer their home, whereas in Gloucester and Cheltenham they're very much based where they're living. So yeah, lots of support available for students. We want them to be okay, but it can be a very difficult full-on course at times, and it may be that they just need a bit of extra support and time. So please do let us know if you are concerned about any of our students. If a student does have a medical condition or certain circumstances that might affect their ongoing life and placement experience, then they may well have a health abilities passport, also known as a HAP. Within the health abilities passport is reasonable adjustments, which they may or may not have. They may just want to use it as a document to share with you to let you know what their condition is and what they may struggle with, or they may have this document so that they can have a list of reasonable adjustments that you may be able to support them with in placement. So this was previously called an access plan. It changed over the last couple of years. So if you're not familiar with the health abilities passport terminology, it was what we previously called an access plan, to be able to help students find placements a little bit more accessible and tailored towards their needs. So the health abilities passport is filled out with a professional at the university, and what we do is document the student's needs, and also any recommendations from occupational health or healthcare professionals that have been involved in their care previously. The document will contain a list of things that they feel they are really good at, and you know, their strengths within placement, but also the areas that they may find more difficult, or need more support with. We will then help them compile a list of any reasonable adjustments that they may need that will make placement more accessible to them. Now, we do try and make these adjustments as reasonable as possible, because there are certain things that will just not be reasonable within the placement setting. And unfortunately, sometimes students just aren't fit to practice, or are not appropriate for that placement setting or the course in general. So these should be adjustments that are reasonable and able to help them to achieve placement, but also they still need to meet the standards required of the NMC, and the course outcomes. So the reasonable adjustments will be completed with a member of staff, and we will make some ideas within there of what needs to be looked at. So you can see the example on the screen here is shift patterns. So the university staff member has suggested that the student doesn't have a late shift followed by an early shift, no more than 3 in a row, and no nights. And that may well be because a student has, for example, epilepsy medication, or they might be diabetic, or have some kind of other chronic condition or a mental health condition. And it may be that they don't sleep very well, or they take certain medications in the evening that means they can't get up early. And this kind of shift pattern will allow them to function better and make sure they're not having time off placement unwell. Now, this is a recommendation, and we would ask where you can to try and achieve this within your placement. However, if you do feel that any reasonable adjustments are unreasonable or not achievable, please do speak with the coaches in practice, and we can support that, and we can change the agreed adjustments. And all placements are different, so we may put a general adjustment in, but it may be that actually in your placement area it's completely different, and we need to think about something very different for that specific placement. So health abilities passports can change over time, or that it might be that we have a discussion before every placement to make sure that we can tailor it to that area.
Health abilities passports are owned by the student and they are confidential, so they can only be shared by that student with you. We can share it with their consent, in an email with their written consent. However, we would normally suggest that they share it with you. It's their document, for them to use to help them in their placement area. If the student chooses not to share that with you, that is up to them. However, it would be very difficult for them to kind of get agreed reasonable adjustments if they aren't able to share the document with you. If you do have a student that states that they have one and they have agreements, but they're not willing to share it with you, but still want the adjustments upheld, you can contact the coaches in practice who can confirm whether or not there is a HAP, and we may also suggest to the students for them to share that with you. Although you can see here there is one about shift patterns, we wouldn't, as mentioned previously, change it to purely, for childcare reasons or anything like that. This would be a health reasonable adjustment and a way for that student to attend, despite their health challenges.
Okay, so finally, how to access support if you do need it. So in the first instance, we'd say, please reach out to the coaches in practice. So if you've got a student in placement, you need any advice or support, just come through to practicesupport@glos.ac.uk, and that will get you through to the coach in practice inbox, which is monitored Monday to Friday in normal working hours, so sort of 9 to 5-ish.
We also have a practice support website, and the link is on here. And there you will find lots of guidance documents, training opportunities. We've also got an EPAD tutorial. So if you're not familiar with our EPAD, it's very similar to this, where we go through all the different areas of it and how to use it. You can also see the students' year planners, and other signposting on there as well. Coaches in practice do have their own separate email addresses, and it may be that you know your coaching practice and you contact them via that. However, we do all work part-time, so if you're struggling to reach anybody, practice support will always be monitored. So that's going to be your best bet for getting a coaching practice, who's going to be your first port of call.